The case of the Sufferers Hospital murders. In the heart of a sprawling, bustling city, amidst the hum of traffic and the constant flow of life, there stood a hospital. Known as Sufferers Hospital, it was a place where the sick, the broken, and the destitute came seeking care. With its old brick walls, long hallways, and the scent of antiseptic hanging in the air, it was an institution that had served the community for decades. Little did the people know, however, that within these walls, a sinister series of events was unfolding, one that would come to haunt the city for years. The murders at Sufferers Hospital began in the late 1980s, though no one realized they were happening at first. The hospital, like many, had a reputation for treating the most desperate cases, patients whose conditions were often too advanced for most doctors to treat. These were people who arrived with no family, no hope, and often no identity beyond their ailments. Many were homeless or facing financial ruin, making them easy targets for someone with a darker agenda. The first victim, Margaret Turner, 1987. Margaret Turner was a 59-year-old woman who had been struggling with chronic kidney disease for years. She had been a regular patient at Sufferers Hospital, undergoing dialysis treatments to manage her condition. She was a quiet woman, known to the nurses and doctors as someone who kept to herself. Margaret's death came suddenly one evening after her routine treatment. The attending nurse found her lying in her bed, her face pale and her eyes wide open, as though she had seen something terrifying before she passed away. There were no signs of violence, no visible wounds, no indication that foul play was involved. Her medical records showed that she had been in a deteriorating state for months, but her sudden death caught everyone off guard. The doctors believed it to be a natural death, a complication of her condition. There was no autopsy done, and the case was closed quickly. But Margaret's death would not be the only one. Over the following months, more patients in similar conditions began dying mysteriously, with no apparent cause. Each death was ruled as a natural one: heart failure, kidney failure, strokes, or other medical complications. Yet something didn't sit right with the hospital staff. The deaths were occurring with increasing frequency, and many of them were too sudden to be attributed to the patient's underlying health issues. The second victim, Harold Jenkins, 1988. Harold Jenkins, a 72-year-old man with severe heart disease, had been a patient at Sufferers Hospital for weeks, receiving care after a series of heart attacks left him in a fragile state. He had been through several surgeries, and his condition had been closely monitored. But when Harold died suddenly during the night, the circumstances raised more questions than answers. Unlike Margaret's case, Harold's death was accompanied by a faint, unsettling smell, a chemical-like odor that lingered in his room long after he had passed. The attending physician, Dr. William Blake, noticed the odor immediately but thought little of it at first, attributing it to the disinfectants used in the hospital. However, when Harold's body was examined, something peculiar was discovered. His veins appeared to have been collapsed. His organs showed signs of internal bleeding, yet there was no external trauma to explain the cause. Suspicion grew among the hospital staff, but the case was still quickly dismissed as another natural death, perhaps a result of Harold's fragile condition. Still, whispers began circulating among the nurses and doctors, some of whom were beginning to suspect that there was something more sinister at play. The deaths continued to pile up, each victim suffering from serious illnesses, each passing without warning. The hospital staff began to notice a disturbing trend. Patients who had been seemingly stable would suddenly die in their sleep, often accompanied by the same mysterious chemical odor found in Harold Jenkins' room. The more these unexplained deaths occurred, the more people began to wonder if there was a murderer in their midst. The staff at Sufferers Hospital became increasingly paranoid, with some nurses refusing to work night shifts. Rumors began to swirl that a staff member might be responsible, but no one could prove it. The deaths kept coming, with the victims all in the same vulnerable position. Sick, often with no family to speak for them, and sometimes with medications that could easily be tampered with. The investigation begins. It wasn't until 1989, when a particularly gruesome murder took place, that the hospital administration finally decided to take action. Alice Campbell, a 63-year-old woman with advanced liver disease, was found dead in her bed after her routine checkup. She was another victim who had been under care at the hospital for months, but this time, the circumstances were different. Alice's body was discovered in a pool of blood, something that had not occurred in any of the previous deaths. The blood loss appeared to have come from her mouth, and upon further investigation, doctors found that she had been poisoned with a rare substance, one that was not typically used in the hospital. It was a powerful toxic agent, capable of inducing heart failure, and it was clear that Alice had been murdered. This discovery forced the police to get involved. Detectives arrived at the hospital conducting a full investigation into the mysterious deaths. The question was no longer whether there was a serial killer in the hospital, but who the killer was and how they had managed to carry out these murders undetected. The investigation led to interviews with the hospital staff, and as the detectives dug deeper, they discovered several disturbing facts. One of the nurses, Christine Walker, had been working the night shifts during many of the deaths. She was a quiet, unassuming woman who had been employed at Suffers Hospital for nearly a decade. On the surface, Christine seemed like the perfect caregiver, a kind, attentive nurse with a spotless record. However, as the investigation unfolded, it was discovered that Christine had a history of substance abuse. Her personal life had been a chaotic mix of failed relationships and financial problems. Her drug use had worsened over the years, and she had become increasingly erratic in her behavior. During the investigation, it was revealed that Christine had been stealing medications from the hospital's stockroom, including the rare toxic substance that had killed Alice Campbell. Yet even more chilling was the discovery of her medical knowledge. Christine had worked in the hospital long enough to know exactly which patients would be the most vulnerable. She had been selectively administering the fatal doses of poison to those who were already ill, knowing that their deaths would be overlooked. Christine's motive was never fully understood. Some believed it was financial, the possibility of a payout from life insurance policies she had arranged for several patients. Others speculated that she was driven by a deep-seated resentment for the suffering she witnessed daily in the hospital. Whatever the reason, Christine Walker had taken it upon herself to decide who would live and who would die. The arrest and aftermath. Christine Walker was arrested in 1990 after the police found enough evidence to charge her with multiple counts of murder. However, the full extent of her crimes was never fully understood, as many of the early deaths went uninvestigated and were ruled as natural causes. In total, it was believed that she had killed at least 7 patients, though some speculated the number was much higher. Christine was eventually convicted of second-degree murder for the death of Alice Campbell, though many believed she was responsible for far more. The case sent shockwaves through the medical community, particularly in hospitals where staff members were trusted with the lives of their patients. The Sufferers Hospital murders became a chilling reminder that even in places meant to heal, danger could be lurking in the most unexpected places. The name Christine Walker became synonymous with the worst kind of betrayal by the very people who were supposed to care for the sick. Her actions left a permanent scar on the reputation of the hospital, and the case became one of the most infamous medical murder mysteries in history. As for the victims, their lives, though tragic, were not forgotten. Their stories remained a haunting reminder of the evil that can sometimes hide behind the mask of compassion